Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. And in this edition, we are going to talk about how is Dr. Marida P as a instructor. People often want to know, how am I as an instructor? What do people have to say about me? What do students typically say about me when it comes to me being an instructor? I'm an associate professor. If you want to see what they say, stay tuned. Back. My name is Dr. Marida P. I am a registered nurse. I've been a nurse for 16 years. I am an OB/GYN, well baby nurse, nursery nurse, and I'm a nurse educator, associate professor. I am doctorally prepared, and I teach at a HBCU. Now, with that being said, let's jump into this video. People want to know, how is Dr. Marida P as a instructor, associate professor, whatever you want to call me? Truth be told, I'm probably one of the hardest ones that most will ever meet. And I say that because of the fact that they become to realize that I don't play. And I don't play. And honestly, through these videos, I probably have conveyed that I don't play. I'm very serious about nursing in general, because we are here to help elevate the plane of nursing. Plus, we're here to save lives, or to at least keep you at your baseline, if nothing else. We are here because we're here to care for people. And I think that people lose sight in terms of what nursing really is and what we really do. Now, the people on the front lines right now fighting this COVID and taking care of patients, they get it. But these students coming through here, I don't think they get it. So what is it like? I'm often described as being the hardest one. I've taught at a PWI, which is a predominantly white institution. I taught there for about 15 years. Yeah, 15 years. And because I was one of the only ethnic minorities, we had about 3 of us, but I think I kind of fit into that category of being that strong Black woman that was not really well received. However, I was there for 15 years. And so when students came into the program, they already was warned about who I was, and when you get to her, she's going to be very hard. And I'm not one to make students cry. That's not it. But I did have this one student who, she just looked at me and started crying. I didn't say anything. It was the first day. I hadn't said anything to anybody besides the fact, let's go check our meds. And she broke down crying. She said, I'm so intimidated by you. That wasn't even my issue, because I hadn't did anything at that point. So I hadn't said 2 words besides welcome, let's go do this, that, and the other. Let's go check our meds for our patients. And she couldn't handle that. I will say this, I will not change my personality because when people say, oh, well, people are intimidated by you. Or when people say, you have such a strong personality. So are you implying that I need to change my strong personality because you have a weak personality? Is that what we're saying? So if you don't have to change your weak personality, I should have to change my strong one. Now, with that being said, I don't mean being mean. I don't mean anything but like that. I am direct and to the point. I don't sugarcoat things. And that's the part that people can't handle. That is not my problem, because guess what? This world doesn't sugarcoat shit. Okay? You get what you get. And so when it comes to teaching my nursing students, I don't give answers. I tell them, I believe in what's called self-directed learning, which basically means go look it up. If you want to know what something is, go look it up. If you can't find it, or it's an emergency situation, then we will discuss it. But if not, don't come ask me what something is when it's in your textbook. Don't come ask me what something is when you just had a lecture on it the other day. I'm not going to tell you. Why am I not going to tell you? Because of the fact that we remember things when we actually have to put work in. And I'm going to do a video on entitled nursing students here soon. You'll see that soon. And it kind of falls into that generation of that. But I'm not the one to do that. I'm not one to give you the answers. I'm one to have you go look things up. I'm not one to give you free. My students this semester said, do we not get extra credit? No, because where did they do that at? This nursing program doesn't do extra credit. You think we're going to give you extra credit because you didn't do all your other assignments, so now you're failing and we're going to give you extra credit to help boost your grade up? And you think we want you to be a nurse? I don't want everybody being nurses just because you want to be here. That's the truth. That's the God honest truth. I do not want everybody to be a nurse just because you want to be a nurse. If you don't put in the effort that's required to become a nurse, you will not become a nurse at our program. Period. Do you want doctors to become doctors just because they want to be? Do you want to have a D doctor working on you? Do you want to have a D or F doctor who got passed because of what they look like to work on you when they don't know what they're doing and they're dealing with your health? No, you don't. If you lie and say you do, well, then you know what? You are, again, the exception to that. So I'm very hard. I'm very hard on my students. But I will say this. At the very end of the day, when they finish school and they go out there to that world and they come back to me and say, you know what? I truly did not like you in nursing school, but I love you now. I greatly appreciate everything that you've done for us. I greatly appreciate everything that you made us do. You made us do the work. I get it now. I didn't get it then. And that, my friend, is why I know I do a good job at what I do. It's not because I get all the accolades when we're in the program. It's because at the end of the program, the ones are those who are preparing themselves to truly be a nurse. The ones who truly want to become a nurse will become a nurse because they have listened to the principles that I've given them. They will apply those principles. They will definitely make sure that they do what they need to do to become a nurse. They will listen. And because they do all those things, they become successful and they become, nurses and actually go out there and do fine. Now, again, do people do fine without the way I am? I'm sure they do. But like I have met students who, because I didn't have them, or let's just say I had a student that I was working with and then they had another student who they were not in my clinical group. They're not doing so well. They didn't pass the boards the first time. They weren't given everything. They were never been made to study. They were never forced to read their book. They were not forced to be self-directed. And as a result, they didn't pass the boards the first time in their situation. The ones who come through my clinical, when they go check off for clinicals, they got that head to toe assessment. I do OB, so they got their head to toe assessment down. They know I don't play. No, there's no extra credit. No, there's no curving of grades. We don't even round grades until the final grade. So if you have like a 82 or 80, let's say a 84 is a B in our program. It's the lowest B you can get. So if you have an 83.4, you have an 83, which is a C. If you have an 83.5 at the very end, then we round up to an 84, you have a B. So people often mistaken that someone who is nice to you and easy to you to be good for you. I want to tell you that's far from the truth. Someone who is, and when I say hard on you, I don't mean like they're giving you a hard time. They're trying to see you fail. I mean someone who's trying to challenge you, someone who's trying to say, okay, let's make sure that you got this right. Let's go ahead and do the work. I had my students charting, and the other instructors didn't have their students charting. Oh, the instructors would say, they'll get that in the real world. Okay, well, in the real world, they're already behind the 8 ball when they come out because they don't know how to do nothing. So if I can actually introduce them to charting, even if it's just a chart, one head to toe assessment and some vital signs and some I's and O's, and that's all they have to do. So as I was saying, I'm just one of those who I am definitely a more difficult instructor. I'm one of those who, I'm going to actually insert something that one of the students left in terms of, we were doing group presentations. At the end of this video, you can kind of see, one of the messages that one of the students left, or this group left after. Now, mind you, this particular group of students, they bombed the test. They failed the test, and they wanted to blame me because of the fact that they said I didn't teach the material. And I'm like, okay, how many of you actually read the chapter? Half of them raised their hand. I said, well, that's the reason why you failed. And no, we're not going to do a retake. No, now that we know how the test is, can we retake the test? No, this is your grade. So the ones of you who made a 36 on your test, that is your grade. And, oh, we didn't know that it was that serious. That's not my problem. Again, I am one of those who, if you want to be a nurse, I am here to guide you in that process. I'm here to help you be a nurse. If you think you're gonna play yourself, play around, and think you're gonna play in the program, I will weed you out. And that's exactly what I do. I will weed people out so quick, because I'm like, if you don't take this seriously, if you don't take taking care of other people's lives seriously, we have a real problem. I take my job seriously, because you will not come for me representing me talking about she didn't teach us nothing. So if you don't have the mentality to say, okay, you know what, I'm here to learn, I'm here to really put in the work, then I got you. I definitely got you. If you ain't here to do that, then you need to find another career option. So that's me in a nutshell. I'm going to put this right here. This is what they think of me. This is what my last group, they had sent me this little message via their PowerPoint presentation. I'm going to insert that here. But if you want to follow me on IG, here's my handle. But until the next time, you all take care. Bye-bye.